I want to talk about a real common condition that is occurring, and that's shoulder injury, shoulder restriction, shoulder pain. The shoulder is a very complicated joint. It's where three bones come together: the collarbone, the scapula or the shoulder blade, and the humerus part of the arm. So you have a lot of muscles that tie in there, and they attach the bone with tendons. The tendons attach to the bone by way of a Velcro type system with sharp fibers underneath. And when you overreach, which is usually involved in shoulder injury, whether you're reaching in the back seat of the car and you're in the front seat, or you're going for that top shelf, or reaching over boxes or something, that puts a lot of strain against the shoulder because of the long leverage. It magnifies the strain. So that can pull the tendons up, and once that happens, the brain stiffens the joint to keep it from getting further injured. So you're physically capable of full range of motion. The restriction is a nervous system guarding of that joint. So once you reattach, which I've been trained to know how to do, there's only a few chiropractors that know how to do this, it's almost immediate improvement in range of motion and pain. There's two other factors involved, and one is the nerves that go to the shoulder come out of the lower neck. So if you can have misalignment or a disc problem causing pressure on that nerve, it sets you up for trouble in the shoulder. Another factor in shoulder problems can come from the spine. The nerve supply of the shoulder comes out of the lower neck, and it can be affected by two things: misalignment or disc problems. And if you have pressure on that nerve from one of those two things, it sets you up for trouble in the shoulder because the nerve pressure will cause it to be weak and vulnerable. We look at all those different factors when we're addressing shoulder problems, and we have a very good success rate. So if you or someone you know has a shoulder problem, have them come in and let's take a look at them and see if we can help them.